Welcome to 22 Fifth Street. This is our Stamford location here at CHC, and we are excited to give you a tour, hopefully to offer a little flavor and a little insight into what our office looks like. So we'll take you inside and show you around. So as we enter, we are in our waiting room and our lobby area where we have a few options for our patients to be able to check in for their medical appointments. So here we have our kiosk where patients can click on the screen and make their way through registration, or we have our front desk where we have our patient service associates who can help our patients real time in person with any questions they may have or with check-in. We also have a virtual PSA option where if our patient service associates are busy helping other patients or clients, we have a virtual option here where they can step right up and chat with someone who is not on site but is live and able to answer all questions for help check-in. As we continue this way, we have our phlebotomy services, so patients can get their blood work done here on site at CHC through Quest. So the lab is open Monday through Friday from 8 to 5, and it's really convenient for our patients to be able to just go from their visit and head right down to get blood work, or they're welcome to come back on another day if it doesn't work to go right after their appointment. We also have urgent care services, and so if our primary care providers are booked and busy, but someone has an acute complaint, a concern, an illness, something that they want to get checked out, they are able to schedule with our urgent care provider. The rooms are set up very similarly, almost identically to what we have upstairs in primary care, but it is more of an urgent care focused. We also have an option for some virtual care and some virtual support. So if a patient would like to see a provider virtually, for example, their behavioral health clinician who might only be offering behavioral health virtually that day, the patient is welcome to come in here and use our technology, our electricity, our space to be able to accommodate that visit. Consistent with our other CHC sites, here at our Stamford location, we have a really wonderful team of operations members who are integral to making sure that our patients get the care that they need and that the clinicians and medical team and behavioral health team can do what they love to do, which is taking care of our patients. So this part of our office is our administrative suite, where we usually have our operations manager, our IT teams. Right now we have some of our AmeriCorps members who help out with patient engagement, all located here in this area. So the clinicians know exactly where to go if they have a question, and the team members here can do all that they need to do to keep everything running really smoothly. As we transition from the administrative area and pod, we go into the medical pod. And so that's where our team is all co-located, sitting right next to one another to be able to have easy access to answer questions, to collaborate, to share information, and to make sure that we're really getting the patients what they need. So each person has their own desk, but they're sitting next to other valuable members of their team. So if it's a medical provider, they're sitting next to the medical assistant, the nurse. If it's one of our behavioral health clinicians, they're usually sitting near a medical provider that they work a lot with. So again, there can be that high level of collaboration and communication, which we know is so important for streamlined and high quality care. This is an example of one of our exam rooms. Each of the rooms are very, very consistent. So whichever room you're in, it's gonna look and feel the exact same, more or less. We have our vital sign machine nicely tucked away on the wall, out of the way, easy access for our medical assistants, nothing that they need to move or roll. We, in all of our rooms, have our phones adhered to the wall, so we can easily press speakerphone and press a button that says language line to access our interpreter services, who can help us with over 170 languages to make sure we can quickly and efficiently get an interpreter on the line to make sure our patients are cared for in the language that they prefer or that they would like. As we continue this way, we will head to our medication room as well as our lab. And so our medication room is really well run by our nurses. They take care of all of the pieces of making sure we're in compliance and regulation, and we're incredibly grateful to the nurses for that. So similar to our exam rooms, the medication rooms look really consistent on our different floors and even in our different offices. We have our vaccinations, we have medications that we can give if patients need here in the office, for example, for treatment of STDs or latent tuberculosis. We also are really fortunate to have IUD and Nexplanons here so that we can do same-day insertions or removals if a patient wants or needs. And we'll head into our lab. And so our medical assistants really help us here in the lab to make sure that everything is running smoothly. But we have access to the tests that we really want and need in primary care. So pregnancy tests, urinalysis, hemoglobin A1C, flu, COVID, all of those things that you want to be able to have to make good decisions for your care and your treatment and what our patients need. This is our break room where people can have lunch, share a meal, take a moment to relax during the halftime of a busy day. We also have the opportunity to come together for meetings. We have a screen that comes down, and so it's a great opportunity to be up to date on everything going on in the organization or at the site here all together in our community conference room. Thank you so much for joining us on this tour of our Stamford CHC location. We hope that you enjoyed seeing a little bit of how we deliver care and the environment we do it in, and we hope to see you in person soon.